Took me a minute to find my way. Hi.
Take it away.
Oh, thank you so much. Welcome, everyone. Hello, I'm Allison Hamilton. I'm a professor in psychiatry, an anthropologist, and implementation scientist by training, and I lead the UCLA Rapid, Rigorous, Relevant Implementation Science Hub, and I see several members of my amazing team in the group. So thank you so much for everyone who's here. I'm just going to briefly talk about this hub, which is a supplement to CHIPTS, and which is really one of my most favorite things to work on. So I'm excited to tell you a little bit about it in just a few moments. We can go to the next slide. So just really briefly, before I tell you about the hub itself, I just wanted to make a couple of quick comments about why we are concerned about implementation science and the Ending the HIV initiative overall nationally. I mean, implementation science has a huge role to play, potentially and actually, in part because systems, are really looking, of course, to provide high quality services, but are often pressed with insufficient resources. And, standing up evidence-based practices in that context can be quite challenging. So implementation science, I believe, is here to help by offering evidence-based strategies that really help with the process of putting evidence-based practices into care and potentially de-implementing practices that are not evidence-based and are not producing the desired outcomes. So there's been plenty of statements and missions that would suggest that we really need implementation research to help with ending the HIV epidemic, and that such research needs to be rigorous, of course, but also needs to be rapid and relevant, because we don't want to wait for a decade or more for the good things that we learn and produce from research to actually make their way into the care that people are receiving. And so that's really the mission of implementation science, is to shorten that gap between developing the evidence base and making sure that those interventions, programs, policies, et cetera, are actually reaching the people they were intended to reach. So that's just a little plug for why implementation science. And now I'll tell you just briefly about our hub. Next slide, please. So our hub, which is on its third year now, the goal of our hub is to provide leadership and support for this type of research, implementation research, and we really emphasize pragmatic study designs and methods. And at the heart of what we do, and I know it's at the heart of what so many of you all do as well, are issues of health equity and sustainable solutions. And so that's very much in our wheelhouse and what we really try to emphasize across the board with our activities. Next slide, please. I have the best team a person could ever ask for. Many of these faces you are quite familiar with. I won't go through the whole list because it would take too much time, but we have a stellar team here at UCLA. And then we also have an incredible team of consultants who you see along the bottom there, along with Elena, our wonderful project director, who are outstanding and very well-known implementation scientists who have played a really critical role throughout the course of the hub in providing support to our awardees as well as the broader implementation science community. So thanks to all of those folks. Next slide, please. So just really quickly, our hub activities. So I should have mentioned that our hub is one of 8 hubs. There were 5 and 3 were recently added. So there are 8 hubs throughout the country. And each hub is assigned a set of EHE awardees. So we have anywhere between 7 to 8 to 9 awardees that we're sort of actively working with at any given time. And what we do for the awardees is provide consultation, coaching, technical assistance, feedback, often on proposals, things like that. And then support with the reporting requirements that are based with the coordinating center at Northwestern. as well as just offering as many resources and opportunities as we can in this space. And then our other services are always available to our awardees, but are also available to the broader community, really nationally, certainly in Southern California. But we do a lot of implementation science methods workshops. We're all methods geeks. We love methods. So we do a lot of methods workshops. Those are all available on our YouTube playlist that Elena set up, and you'll see that link in just a couple slides. We also do beachside chats, which is where I and my team chat informally with leaders in the field about sort of timely, pressing topics in implementation science that have relevance for HIV research and practice. And we do offer some consultation. Not massively, because we do kind of focus those efforts on our EHE awardees, but we provide as much support as we can to, of course, the CHIPTS community and our, fellow hubs, et cetera. So that often comes up around grant proposal time, where we provide support for people who are working on implementation science related grants. Next slide. Thank you. So happy to answer any questions. And the next slide gives our YouTube playlist. So all of our events are available there for no cost, of course. And if you have any questions about what we do or want to know more, please feel free to reach out to Elena, as she knows where to find me. And we look forward to hearing from you and supporting you in whatever ways we can. Thank you so much.
Terrific. Thank you, Dr. Hamilton. If anybody has any questions, please write them in the chat box. And like I said, we'll address all the questions after all three presentations are done. Our next presenter is Dr. Waiti Chen, who's going to be talking on addressing intersectional oppression in Asian Pacific Americans with HIV.
Hi, this is Waiti Chen. I'm an associate professor at School of Nursing at UCLA, and I'm very, very honored to have the awards in this EHE. It's our first time, and the focus is the Asian Pacific Americans with HIV. Next slide. So just give you some backgrounds. The local EHE plane release from the Department of Public Health from Orange County and Los Angeles County do not include any Asian Pacific Americans with living with HIV in any blueprints that publishes online. And so in fact, the structural racism against APA runs rampantly in EHE. In fact, that we cannot find any data into it, especially in the public policy and strategic planning in HIV epidemic in the United States. Especially in Orange County, more than 20% of the population identify as APAs, but there's nothing talk about APA-WH in this population. Particularly, APAs are the only group that experiences increasing HIV epidemics based on the indicator of new diagnosis and percentage of high-risk tester. So the official documents are omitted from the rest of the analysis in anything that publishes in currently we can find out from Los Angeles County and Orange County. So that is what in order to understand how APA engage in care, especially in Orange County, that they are the only racial and ethnic groups that exceeds 20% of the newly diagnosed have already developed AIDS. So which means that in our population, most likely they are diagnosed late, and then many of them are full-blown AIDS when they are diagnosed. So in next page. So for this project, that our purposes of this study is really want to adapt and evaluate the appropriateness of acceptability and feasibility of 4-session, 4-week social justice-oriented family-informed self-managed intervention to promote healthcare, health from APA-WH in Southern California, particularly in Orange County, that we call the intervention as SOPHIA. So this premises that APA-WH experience systemic barrier for healthcare delivery and policy, resulting in poor outcomes. And additionally, regarding of their ethnicity, APA often prioritizes their responsibility to their families over their own individual needs. So the hypothesis that will receive SOPHIA in acceptable, feasible, and appropriate for future study to promote family support, decrease effect on structural racism and HIV-related stigma to achieve better outcomes in this population, and really address the curricular needs for this APA-WH populations. Next page. So our two study aims is that for the first years that we will utilize the implementations research logic model to guide our reanalyze the available qualitative data and revisions of the SOPHIA intervention. And we do have the all 40 plus APA WH qualitative data that we collected several years back. So we do have those data, but we never analyzed their stigma experiences and their SOPHIA potential intervention can be implemented. So the second year will be working on pre-test and post-test design on the 20 APA-WH. Then we will adjust the SOPHIA intervention based on the result of pilot test. And also additional input from our CAP and population set from APA-AIT that where we're going to recruit our study participants. Next page. So this is the logical models that as this is our first project, is working using implementation science. We do have our determinants and implementation strategy and mechanism and outcomes. And mostly the outcome will be the same that I just mentioned, that accessibility, appropriateness, and feasibility of the SOPHIA. And then hopefully the preliminary effectiveness of the SOPHIA can on the family support, illness, experience, and self-management can providing the health indicator, including quality of life. Next page. So give you some idea about what is SOPHIA includes. There are some challenges on the first row that including there are 8 different modules. The module 1 will be focuses on psychoeducation. Module 2 will be cognitive behavioral management skills training. And the module 3 will preparation for disclosure. And module 4 will be family relationship and support management. The 5th one will be social cognitive training and mindfulness training. And the 7th is symptom reduction. And the module 8 will be the lifestyle, including stigma reductions. Next page. So the summary for this project is that we are hoping to use the SOPHIA intervention to test it and pre-test and post-test to whether this intervention will be useful and acceptable into this populations in APA-WH population. Okay, next page. Okay, so that is my presentation.
Great, thank you very much, Dr. Chen. And as I said, please type any questions in the chat box and we will address them at the end after all the presentations. Our final presentation, and thank you both for staying on time, by the way, is by Dr. Laura Hoyt, Everardo Alvizo, and Jalen Owens on implementing a community-engaged equity approach to identify barriers and facilitators to the PrEP care continuum in Long Beach, California. Take it away.
Okay, thank you very much. Special thanks to Allison and her team, who were very supportive as we were preparing our application. Like the previous presenter, this is our first EHE supplement, and we're really pleased to be part of this group. Special thanks to my co-investigator, Everardo Alvizo, from the City of Long Beach Department of Health and Human Services. Our partnership with him and the community groups that are involved in this project are integral to this. And also to Dr. Harawa, who is our co-investigator on the project, and to my co-presenter, Jalen Owens, who is our health education and outreach specialist coordinator for our team. And there are a couple of other members of our team here. As mentioned, my name is Laura Diana. I'm the director of the Center for Health Equity Research at Cal State University Long Beach. Slide, please. Okay, so this study aims to address the HIV epidemic by improving consistent PrEP use along the care continuum among Black and Latinx same-gender loving men, transgender women, and other gender diverse persons in Long Beach. who are disproportionately affected by HIV/AIDS, as we have heard already during this conference, and have low engagement in the HIV prevention continuum. There is very little information about the system's community context and individual factors affecting consistent PrEP use by Black and Latinx individuals in places such as Long Beach. And therefore, our research team engaged in an equity-focused approach to identify PrEP-related needs through partnerships with the community, as already mentioned, the Long Beach Comprehensive HIV Planning Groups, PrEP and Trans Wellness Work Groups. And these groups include individuals affected by HIV. This is a mixed methods exploratory study that combines elements of the PRISM and EPIS frameworks. Next slide, please. And our research questions are, among community members, what are the experiences and perceived barriers resulting in low engagement along the PrEP care continuum? And among existing and potential PrEP providers, what are the gaps in feasibility of providing culturally tailored PrEP-related services? And importantly, how can these barriers be addressed effectively? Next slide, and I'm going to turn this over to Jaelen.
Okay, hi everyone. My name is Jalen Owens, like Laura has mentioned, and hopefully you can hear me over the air conditioning that decided to come on right before I started speaking. But the methods that we intend to use for this project, for phase 1, we hope to conduct focus groups with Black and Latinx, same gender loving men, transgender women, and other gender diverse populations here in Long Beach. We're hoping to conduct these focus groups with around 30 individuals with good mix of kind of those who are already currently engaged in PrEP services and those who have not yet accessed PrEP or have fallen out of PrEP care. So we can understand kind of what are the barriers to engaging in PrEP and also staying engaged in care. And we also hope to kind of conduct semi-structured interviews with PrEP providers here in Long Beach. And so this includes clinicians and physicians who are already providing PrEP, those who aren't, PrEP navigators and other individuals who are kind of doing the PrEP promotion work in the community or in testing centers or in PrEP service providing locations, as well as pharmacists who intend to implement pharmacist-driven PrEP and other providers who might not be as familiar with PrEP, but may be implementing PrEP in the near future, specifically newly funded health centers who are supposed to be implementing PrEP within the new year. And we're hoping to kind of explore again all the barriers and facilitators to PrEP engagement for both the provider perspective and the community perspective. And then once we're able to kind of conduct all of this formative work, we plan to then develop a survey that we will disseminate in the larger community with 400 community members. So again, Black and Latinx gender diverse populations to further explore the barriers to PrEP care in Long Beach. There will also be surveys disseminated amongst providers during that same period to again explore the same facilitators and barriers. And then lastly, we intend to disseminate the study findings with the community so that we can best identify strategies to improve PrEP engagement here in Long Beach. And you can move forward to the next slide. Thank you. And so the anticipated study outcomes are specifically when it comes to the implementation science outcomes or acceptability, appropriateness, and feasibility for providers and providing culturally appropriate PrEP services. And we hope to then inform the Long Beach HIV prevention strategic plan to make sure, number one, that it aligns with the EHE goals, but also contains all the specific information related to Long Beach to create a goal that's reflective of our community. And then develop a culturally appropriate PrEP readiness and facilitation tool for PrEP providers or PrEP navigators to kind of ensure that they're providing culturally appropriate care to our community out here in Long Beach. And then to identify future intervention opportunities to, again, increase PrEP care within Long Beach. And we want to make sure that we're doing this in a meaningful way for community residents and not feel like we're just aligning with the EHE goals, but kind of creating, again, basically goals and initiatives that kind of reflect the needs and the desire of the community so that they can best kind of identify and create interest in bringing into the epidemic here in Long Beach. And then lastly, kind of potential outcomes for future research. We hope to then continue to look at kind of the service and equity and availability in PrEP for all individuals here in Long Beach. And then kind of patient-centered care and effective PrEP care here in Long Beach to ensure that we're being effective. And then make sure that we're creating an environment within PrEP providers that's kind of satisfactory to Black and Latinx gender diverse populations to, again, increase engagement. And then to the last slide, if we run out of time for questions, you can, oh, sorry, maybe not. I have one more slide before then. You're good. That's the right one. Where we are right now, we plan to start conducting our semi-structured interviews with providers starting this month, and then move on into the focus groups with the community starting in January 2023. And to reach this place where we are now, we've had an intensive process of working with the community to get their feedback on kind of the goals of the project and what we intend to ask in our formative work, and making sure that we're kind of answering the questions that are on the minds of current providers here in Long